Welcome to the AVMA Axon On Demand webinar series. I'm Negan Senatori, and I'm the Associate Director at the Center for Animal Law Studies at Lewis and Clark Law School, and I'm co-chair of the ABA's Companion Animal Subcommittee. I'll serve as one of your hosts, along with Dr. Kendall Houlihan, who is AVMA's Associate Director of the Division of Animal Welfare. This webinar will discuss protecting people and pets from domestic violence. In February of 2025, the American Bar Association House of Delegates overwhelmingly adopted Resolution 504. That's an ABA policy that urges action to protect domestic violence survivors and their companion animals. Your materials include a copy of the resolution and the 15-page report that details the importance of the human-animal bond and the proven link between domestic violence and animal cruelty. Up to 89% of domestic abuse survivors report that their companion animal had been threatened, harmed, or even killed by their abuser. Survivors often delay leaving an abuser, or they're forced to leave their animals behind when seeking safety for themselves due to a lack of options for the well-being and safety of the animals in their family. The resolution calls for cross-disciplinary training on the link between domestic violence and animal cruelty. And this webinar brings together professionals from law, veterinary medicine, and social work to share their expertise on this important issue, highlighting how interdisciplinary collaboration can protect human and animal welfare. I'd like to tell you about our three presenters. Attorney Mari Carmen Garza is the Chief Counsel for the ABA's Commission on Domestic and Sexual Violence. Dr. Amanda Beazle is a small animal practitioner who also holds a law degree and serves as an AVMA board member. And Dr. Bethany Poe is the chair of veterinary social work educational programming at the University of Tennessee. To learn more about the presenters, please visit the course page on Axon. This program is a collaboration between the American Bar Association and the American Veterinary Medical Association. It is designed to raise awareness about how these issues may present in practice for legal professionals, veterinary professionals, and other allied stakeholders. This program is also supported by the ABA Tort, Trial, and Insurance Practice Section's Animal Law Committee and Companion Animal Subcommittee. It is also supported by the ABA's Commission on Domestic and Sexual Violence. By working across disciplines, we can provide stronger support for domestic violence survivors and their companion animals. Together, we can save lives. The views expressed in today's program are those of the speakers and not necessarily the organizations they represent. And the information shared is educational in nature and not legal advice. I'll turn it over to our first speaker, Mari Carmen Garza.
Hello, my name is Mari Carmen Garza, and I serve as Chief Counsel for the American Bar Association's Commission on Domestic and Sexual Violence. It's a privilege to be here today and to share the work of the Commission with you. Our mission is to mobilize the legal profession to increase access and justice for survivors. We do this through training, resources, and partnerships that support attorneys, advocates, and communities nationwide. As a domestic violence lawyer of nearly 30 years, I'm honored to be a part of this important conversation, and I look forward to sharing more with you today. Before we get started, I want to take just a few moments to walk you through the goals of today's presentation. First, we'll look at the scope of domestic violence and some key statistics. Then we'll talk about the power and control dynamic that are so central to understanding domestic violence. From there, I'll focus on what we call the link, the connection between domestic violence and pet abuse. This link is important for legal professions and those who care for animals, like veterinarians. You are often on the front lines and in a very unique position to notice warning signs that may point to violence in the home. We'll then turn to the barriers that survivors face when trying to leave a violent relationship, the safety concerns that come with those challenges, and some ways to help address them. I'll also briefly cover the legal protections available to survivors and their pets. Finally, I will close with resources and key takeaways that you can bring back to your own practice and communities. Every minute you sit listening to me, about 24 people in the United States will experience intimate partner violence. That's why I want to start with the numbers. Statistics give us perspective. They cut through assumptions and show us just how widespread and urgent this problem really is. Domestic violence is one of the most underreported crimes in the United States. The truth is that many survivors never actually come forward. Some fear retaliation from their partners, others worry they won't be believed, or they feel too ashamed and have stigma about what they've experienced. Many survivors are financially dependent on their abuser, or they may be protecting children, pets, or other loved ones who could also be harmed. Because of all of these, the data we have is often underestimating the true scale of the problem. But even with underreporting, the numbers are staggering. Over 1 in 3 women and 1 in 4 men have experienced rape, physical violence, or stalking by an intimate partner during their lifetime. And when we zoom out and we see that more than 12 million people are affected by intimate partner violence every year, we know that violence is something that we need to be addressed and that we need to do something to protect individuals. Starting with these statistics is important because they remind us that this is not a rare issue. It is a public health crisis that affects individuals, families, and communities. And it truly sets the stage for the connections we'll be looking at today, including the powerful link between domestic violence and pet abuse. When we talk about domestic violence, we're not talking about one isolated incident of violence. It's not just going to be a single argument or a momentary losing your temper. Domestic violence is really about power and control. It's a pattern of behaviors that one person uses to dominate and control another person over time. And it doesn't always show up as a physical violence. Abuse can be emotional, things like insults, threats, or constant criticism. It can be financial, controlling money, restricting access to resources, or sabotaging somebody's ability to work. And it could also be psychological, manipulating, gaslighting, or making the survivor doubt their own reality. All of these forms of abuse are connected by the same goal: maintaining control and limiting the survivor's freedom and independence. That's why when we're talking about domestic violence, we have to look beyond the bruises. It's about ongoing pattern of power and control. Now that we've talked about domestic violence as being about power and control, I want to show you a tool that really helps us see how that plays out. The power and control wheel. This version of the power and control wheel comes from Respond, which is New England's very first domestic violence agency and the second oldest in the entire country. They have done incredible work in helping survivors, and this updated wheel has been more inclusive, and that's why I like to use it. At the center of this wheel, you will see the goal: power and control. The spokes show the tactics abusers use to get and keep that control. Things like intimidation, emotional abuse, isolation, minimizing or blaming, financial control, coercion, using privilege, and threats. Around the outside of the wheel, you see physical and sexual violence. That outer ring acts like the enforcement. It's what reinforces everything else and makes sure the survivor complies. What I like about the wheel is that it really helps me see the pattern of violence. Abuse isn't just about physical violence, it's a whole system of behaviors designed to dominate and trap someone in the relationship. As an attorney, I find this tool incredibly helpful in my work with clients. I'll often give them a copy of the wheel as homework and ask them to highlight anything that applies to their situation. When they come back, they might have a fully illuminated wheel or just a couple of things that are highlighted. And when I do this exercise, I know it could be a little bit overwhelming for individuals, but it really truly allows me to see the bigger picture. even things that they may not yet be seeing about the abuse and the control. Actually, many of my clients find it incredibly helpful to learn that they're going through is part of a bigger pattern and that they're not alone and that what's happening to them is real. That validation is very powerful and it often becomes the first step in moving forward. In this wheel, I highlighted the cogs that mention pets, which includes threatening to hurt the pets and abusing pets in order to intimidate. The reason why abusers target pets is very simple because it works. Abusers know how much survivors care about their animals. That bond is powerful and they exploit it by threatening, harming, or even just suggesting that they may hurt a pet. They're going to gain emotional leverage. Sometimes it's used as punishment. If the survivor defies them in any way, the pet will suffer. Other times it's about keeping the survivor from leaving. Survivors will often stay because they are terrified of what will happen to their beloved pets if they try to escape. And of course, this isn't just about the adults. Abusers also exploit this deep attachment children feel towards their pets. Using that bond is another way to control the entire family. In this conversation that we're having today, I'm focusing on domestic violence with intimate partners. But this dynamic is used by those who abuse children and the elderly as well. So when we talk about pets in the context of domestic violence, it's important to recognize that pets are not just bystanders. They're intentionally targeted as a part of the abuser's pattern of control. This behavior doesn't happen in a vacuum. Research shows us that there's a strong link between pet abuse and domestic violence. Men and women who abuse pets are much more likely to also abuse their partners compared to others who don't. And in shelters, over 71% of pet owning women report that their abusers harm their pets. So we know this is not rare. It's a part of a widespread pattern. It is also a warning sign. Threats to harm animals combined with things like access to weapons or suicide threats are recognized risk factors for domestic violence homicide. In other words, when we see pet abuse, it's often an early red flag for escalating potentially lethal violence. Some domestic violence programs are including harm to pets and animals in their domestic violence lethality assessments for this reason. This link is now widely acknowledged. In fact, there's an interdisciplinary group called the National Link, and that is a coalition that brings together experts from domestic violence services, animal welfare, child protection, elder services, and law enforcement to address this exact overlap. We must pay attention to this link to protect animals and their humans, and in some cases, to save their lives. How often, when people hear about domestic violence, the first question is, why don't they leave? That question puts the focus and the blame on the survivor. The question really needs to ask, why don't they stop abusing? Shifting the question changes the perspective. It reminds us that abuse is a choice made by the abuser and it is not the survivor's fault. That said, leaving isn't easy, and it's in fact, according to the National Domestic Violence Hotline, the most dangerous time in a violent relationship. The risk of violence escalates when someone tries to leave or end a violent relationship. And many of those domestic violence homicides occur when there is that threat of separation, or somebody's filing for divorce, a protective order, or they're just talking about leaving. In addition to the very real danger of leaving, there are many other barriers that make it very difficult for a survivor to leave. And these include things like having lack of economic resources. They may have shared finances, children in common. They may have an immigration status that prevents somebody from leaving, religion, or just fear. Survivors who want to leave often face impossible choices. choosing between safety and stability, between protecting their children or pets, between their community or starting over with nothing. None of those choices are simple. When we think about the barriers survivors face when leaving, pets play a much bigger role than many people realize. The Palace Report and Survey, which is the largest national survey that has ever been conducted on the intersection of pets and domestic violence, found that about half of survivors would not consider going into shelter if they couldn't bring their pets with them. That shows us the deep connection between survivors and their pets. These animals are not just companions, they are family and sources of safety. But here's the real challenge. According to Red Rover, a nonprofit dedicated to bringing animals out of crisis and strengthening the bond between people and pets, only about 19% of domestic violence shelters in the U.S. can accommodate pets on site. That means that most survivors still face an impossible choice to seek safety for themselves or stay behind to protect their pets who may also be in danger. And even in shelters that do allow pets, there are additional requirements like vaccinations that can create yet another barrier. When someone is fleeing in crisis, they may not have time, money, or paperwork to meet those requirements. On top of that, we know that abusers often withhold veterinary care like vaccinations as a form of control. That means that survivors may not even have the option of meeting these requirements because the abuser has prevented them from keeping their pets healthy and safe in the first place. This adds yet another layer of complexity and danger when a survivor is trying to leave. Both the Pulse study and Red Rover's research highlight how systemic barriers around pets can really trap survivors in dangerous situations, and why we must expand pet-friendly sheltering options. By framing these situations as barriers, we can better understand the difficult, complex decisions survivors face and why support systems must adapt to meet those needs. Because they're living with an abuser, survivors are often constantly strategizing on how to stay safe, and creating a personalized safety plan is an essential part of that process. Safety planning isn't only for someone preparing to leave, it's often for those still living with their abuser who may not be ready or who face impossible barriers to leaving. For example, someone might plan on how to de escalate when arguments start happening, or how to move into a safe room if the house, where to move into a safe room in the house um, where there may be no weapons. Sometimes they'll avoid the kitchen where there are sharp objects, or bathrooms where there are hard surfaces and little room to escape. It is also incredibly important to safety plan when a survivor intends to separate, because we know that's the most dangerous time. Planning might mean arranging for a safe place to stay, having a signal to alert a trusted friend, or knowing the safest route out of the house. Safety planning extends to children and technology, thinking about how to talk to kids in an age appropriate way, or making sure devices aren't being monitored or tracked. And of course, survivors need to gather important items like identification, medications, or even pet records so that they can leave quickly and that they have everything they will need. The key point is that there's never a one size fits all safety plan. Each survivor's situation is unique and must be carefully assessed so that their plan works for them. To obtain help with a personalized safety plan, survivors can reach out to domestic violence programs or the National Domestic Violence Hotline, where trained advocates are available to guide them through creating a plan that meets their specific needs. When we think about safety planning, it's also important to consider pets. The National Domestic Violence Hotline provides guidelines on what survivors can do or start doing to protect their animals. Some of those steps include taking steps to prove ownership of the pet through licenses or vet records, which can be important if there are ever any disputes. If it is safe for them, to make sure their pet is currently vaccinated. Taking advantage of any free clinic when possible, since many shelters or safe housing programs will require that. If the pet has a microchip, updating the contact information so that the abuser isn't listed as and can track their moves as they're leaving. It's also important to start looking into temporary care options for pets if the survivor's planning on leaving, and whether that is going to be with a trusted friend, a family member, or a shelter program that partners with local rescues. And just as survivors may pack a go bag for themselves, it can help to pack a bag for the pet as well, with essentials like food, medications, vaccination records, and comfort items. Including pets in a safety plan helps ensure survivors don't have to choose between their safety and the safety of their animals that they love. Leaving doesn't end the need for safety planning either, especially around pets. After separation, the goal is to reduce visibility and predictability. Change veterinarians. Transfer records to a new clinic and ask them not to release information without a password. Remove any old contacts, addresses, or notes that could lead back to you. Keep pets indoors when possible. It lowers the chance of somebody spotting or luring them. For dogs, one should opt for leashed bathroom breaks over unsupervised yard time. And of course, supervise pets when they're outdoors. Use a secure leash, a harness. Don't leave pets unattended in yards or cars, and consider locks on gates or simple motion lights and cameras if you have a yard. Avoid public parks and dog parks, especially. They're high visibility and easy places for someone to monitor routines. Always choose lower traffic areas or go with a trusted friends. Be intentional about your walks as well. Vary times and routes and stick to well-lit areas. Carry a phone and avoid using earbuds. A few extra things that may also be helpful with digital privacy is turn off any geotagging on a pets or photos, that when you share photos, that there is not going to be a way that they can track back to where you are. Also, if you use groomers or you're boarding your pet, put in no information, no release note on your account. Safety planning is only one piece of the puzzle. Survivors also need legal protections that can reinforce those plans and hold abusers accountable. That brings us to legal solutions. One of the most important tools available is the Civil Protective Order. In some states, they're called restraining orders, but it is very important to know which is which because they don't always mean the same thing. The terminology and scope vary by state, and survivors need to understand what protections are actually available where they live. As of December 2024, at least 41 states, the District of Columbia, and several U.S. territories have statutes that allow protections for pets to be included in domestic violence protective orders. The specifics vary from state to state, but the overall trend is clear. More jurisdictions are recognizing that protecting pets is part of protecting survivors. A protective order is issued by a judge and can be very specific. It states that allow pets to be included. A judge can order that the abuser stay away from the pet, not to take or harm the animal, and not interfere with the survivor's custody or care of the pet. In some cases, the order can even require that the survivor have exclusive possession of the animal. One of the strengths of a protective order is speed and can be obtained much more quickly than waiting for criminal charges to move through the criminal justice system or obtaining a divorce. But most importantly, violating a protective order carries legal consequences. That enforcement mechanism adds accountability and can deter further harm. For survivors with pets, the ability to include animals in these orders is a critical safeguard because keeping pets safe helps survivors stay safe. The ability to include animals in protective orders is a critical safeguard, but protective orders are only one part of the legal picture. Survivors often also need longer-term legal solutions that go beyond immediate safety. One of the most significant of these is a divorce. Divorce proceedings can determine not only separation from the abuser, but also critical issues like custody of children, division of property, and increasingly decisions about the care and custody of pets. In most states, pets are still treated as property. That means the court may simply look at the legal ownership and award the animal to one party, much like they would with a piece of furniture or a vehicle. But there's a growing recognition that pets are more than property. And some states are starting to adopt some form of best interest of the pet standard, little by little, which sometimes allows judges to consider factors like who provides daily care, who pays for the veterinary bills, or where the pet will be safest and best cared for. This shift is especially important in domestic violence cases where pets may be used as leveraged or harmed as part of the abuse. Regardless of the type of legal proceeding, there is one thing I want to stress. It is critical to use experts in legal proceedings that involve both domestic violence and pets. Experts can help courts understand the dynamics of domestic violence, the unique risk pets face, and why protective orders, divorce, and custody decisions must account for those realities. I'm not a criminal law attorney, so I will not go into great detail in this slide, but it's important to recognize that there are criminal options as well. For example, animal cruelty laws may apply if an abuser harms or threatens a pet. These cases can be charged separately and can highlight the seriousness of the abuse. Also, violations of protective orders can strengthen a domestic violence case by showing ongoing threats and disregard for the law. Have access to these important legal solutions that I have discussed and to increase safety for survivors and their pets, we must do the following. One, we must increase the availability of emergency and transitional shelter and include housing options that include pets. Survivors should never be forced to choose between safety and their animals. Two, we must improve access to pro bono legal services so that survivors can secure safe housing, obtain protective orders, and have representation in family law cases where pets may be at risk. And three, we need to expand grant programs, including those created by legislation, to support all these efforts because sustainable funding is essential. This is exactly what ABA Resolution 504, adopted in February 2025, speaks to. As Megan mentioned when she introduced our panel, the resolution calls on the legal profession to recognize the roles pets play in domestic violence and to push for resources and the legal frameworks needed to protect them. And that is why cross collaboration and education efforts to create wider awareness and support for these initiatives is so important. These changes won't happen in isolation. They require us working together across disciplines to make safety possible for survivors and their pets. 5 things you can do. These are usually flagged for attorneys, but they really apply to anyone working to support survivors and their pets. You can actually find them on the Commission's website in our resources section under 5 for 5. Number 1, ask about pets. Pets are often overlooked in conversations about safety planning, but they can be a major factor in whether someone feels able to leave. 2, know your state's civil protection orders provisions and whether or not they include pets. Even if you're not an attorney, just being aware that pets can be sometimes included is useful information to share. 3, research pet-friendly domestic violence shelters and other options in your area. Survivors may not know what resources exist, and this knowledge can be life-saving. 4, learn about free and low-cost veterinary care in your area, or maybe offer some. Barriers like cost or withheld vet care are often common, and connecting survivors to resources really helps reduce those barriers. And 5, know your state's veterinary reporting laws. In some jurisdictions, veterinarians are mandated reporters for suspected abuse, which really can create another pathway to safety. I wanted to close with just a few things to remember. First, recognize your unique role. Each of us, whether it's attorneys, advocates, veterinarians, or community members, has the ability to make a difference in how survivors and their pets are supported. Second, listen with compassion. Survivors are the experts on their own lives. Sometimes the most powerful thing we can do is simply to listen and believe them. Third, know your local domestic violence resources, whether it's a hotline, a shelter, or a pet safe program. Connecting survivors to the right help at the right time can be life saving. And finally, document carefully and always prioritize safety. The way we gather and use information can either increase or decrease risk. So every step should be grounded in protecting survivors and their pets. If you remember nothing else, remember this: by listening, by learning, and by connecting survivors with resources, we can help reduce barriers and open pathways to safety. I'm going to close with a few resources that you can read: the National Domestic Violence Hotline, which can help with safety planning; the Safe Havens for Pets, which is a mapping project that manages a database of pet friendly domestic violence shelters; Red Rover; and also Sheltering Animals of Abuse Victims is another very important resource.
Hi, everyone. My name is Amanda Beazall, and I am a veterinarian who mostly does small animal medicine on dogs and cats, and I work in central Maine. And I am going to be presenting the veterinary team's perspective on animal abuse and neglect and how we play a part in this issue and the link with domestic violence. I want to start here with the veterinarian's oath and call out, you know, something that others may not be aware of, but our oath in veterinary medicine includes benefiting all of society and protecting animal health and welfare, of course, which most of us know that. And then the other important thing is prevention of release of animal suffering. And the big one that it included a lot with what we're talking about today is the promotion of public health. And in thinking about that, a lot of us think about public health when we talk about viruses and bacteria and contagious diseases like rabies. But part of public health is also physical and mental health, and it goes outside the bounds of just infectious disease. And that's where the talk comes in and why it is certainly relevant to veterinary medicine. So, what are we talking about today? So, we're talking about the role that we play in this. And so, our job, like I said, with our oath, is to help the animal patient. And our job is also to protect public health. And so, that includes everyone in your exam room and likely also includes the family members at home. The other thing to think about is, as many of us know, people care very deeply for their animals and their pets. And sometimes your clinic or the people in your building may be the only ones that are in a place where they're going to see or hear about a problem, and no one else is going to know. And so that makes it even more important that you're aware that problems can exist and bad things can happen, and that sometimes we're the only ones that see it, which means we really need to play a role in helping whoever might be affected. There are a couple pictures in this program that might be upsetting. The good news is all of the animals I'm showing you are still alive and doing well. So, but just to prepare you. So, what might you see in the clinic? Uh, so you may see an injured animal. You may see an animal with fractures that don't have a good story behind them, or you're not sure that the story makes sense. You may see an animal with burns. I've seen that happen before, and may see an animal with cuts. I think burns that might be more common if I'm talking concerned about abuse. You may see unexplained bruising, which isn't a common. It's harder to see bruising in animals than in people. They bruise differently, and so if I'm seeing bruising in an animal and there wasn't a known car accident, then I'm definitely really concerned. You may see really old injuries that these things should have been addressed and they weren't yet, and they don't have good answers. The animal may be presented to as a stray, and so the stray could come in through the town, through the police, through local authorities or the shelter, or I have definitely had multiple individuals who present the animal to you as a stray, but it may actually be their animal. And so they're seeking care for the animal. And the question is, are they claiming ownership? Is the animal actually a stray that came around or not? There's a lot of questions here. Often the history is unknown in these cases, or they're presenting a history that just doesn't add up. And so this is where, with these cases, you really do need to pause, even in a busy day. If you think there might be something going on, or your staff thinks there might be something going on, and you really need to try and delve deeper into the story to hopefully figure out what's going on to then help you know what to do about it. You may even see an injured human, could be an adult or a child. Certainly, that's not as common, but I've seen it before in my hospital, and then you have to decide what to do about that. The case may be severe neglect, and so typically we're thinking about abuse as a physical action, but it may just be a lack of action, lack of feeding, lack of keeping an area clean, and so it may look like that. The other thing to think about is it's not always everyone in the home that's affected. It may be a victim's favorite animal, and that is they're using that as a tool to have power over the victim. Um, so there may only be one animal or one person affected, and so if one animal really looks really bad, but the rest look okay, and you're not finding a reason for that, a health reason, then it's something where you should look further. This picture was a stray animal that actually came to my house, and found her, was able to finally get her to come to me by feeding her, and she was missing a leg, and so that was really shocking, covered in ticks, and so, luckily was able to capture her and shared her picture, and the owner actually was 3 miles away, and we were able to get her back there, but it's just something to look into where, okay, this really doesn't make sense, what's going on with the case, and in that end, it was a happy story, there weren't any nefarious activities going on, but always something you gotta look further into these cases. So, really think about a wide range of circumstances. These aren't gonna always look like one thing. They're not like gonna look like a broken bone or a bruise. So it can look like this case where the really severe neglect case that did come in through the police. And so I don't know who the owner is, but just based on my exam of this pet, I knew he actually had been kept confined, and he didn't look like this just like being a stray animal for a month or two, because certain reasons. And if you're a veterinary team and you want to learn more about how to identify these issues, there's lots of good resources out there. We don't have time for that in this talk today. This was the cruelty. So it can range to a level where these cases, something really bad did happen. So in that case, the cat was shot. It was, again, animal came in as a stray. I do think it was a true stray because based on the how old the lesions were, I knew this had happened quite a while ago, but it really was an intentional shot. I've seen multiple where uh, someone had sadly been shooting at the cat, and um, so we were able to amputate this leg, and the cat did great. So now the meat of the talk, what do you do about it? Uh, so there's kind of two sides to the story. So one is, oh no, you have this animal in front of you and you're not sure what's going on. Uh, Write everything down that you can, get as much history as you can. Work with your team members for them to get more history too. But I've had a couple instances where it was actually one of my veterinary assistants who got the true history and found out the true cause of what happened with a patient, and it was not the veterinarian. They may be the individuals or owners may be more comfortable talking to one of the other staff members. Take lots of pictures and get x-rays. If there are injuries or fractures, make sure you x-ray the whole body and just to document as much as you can. And yes, finances do tend to be a concern in these cases, but depending on your state law, we'll talk about that a little bit. You may be a mandatory reporter, and it means your job is to find out as much information as you can so that we can pass the case on to the authorities if you think that's the right step. Another big thing when the situation is in front of you, you have something come in and you're not sure what's going on is I really think this is really important to include the whole team. Often the whole team feels really invested in what's happening and it's often very emotional cases. And we want to make sure everyone feels like the right decision is happening and the full story is coming out and that you work together with a plan. And then what do you do next? So next steps, oftentimes I'm actually talking right with the client about the issue. Of course, it depends on the severity, and we want to make sure everyone is safe. But depending on what I'm seeing, I will talk with the client. A lot of times, especially if it's a neglect case, I am letting the client know that I'm going to report them to the state. I phrase it as a way of saying, I want to make sure someone checks up on you and make sure that everything is okay. Because I don't want them to feel that I am shaming them or make them feel bad for something that they did. We're trying to help and we want to make things better. Uh, then, depending on what's happening, so this list is not in order. It's a list of things you can do, but you got to do what is right in that situation, and they're really case dependent. So sometimes I'll report the case to the ATO, and in my state, I actually report it to one of my state veterinarians. If uh, and then they take it from there. I give them as much information as they need, and then they decide what to do with it. You are not the judge and jury. They'll say you are not the one condemning what's happening. You are just trying to help the animal and help the people in the situation as best you can. The strongest, if you have a really bad case and you're really worried for whoever's involved, would be to have call the police and have them come while the client and the animal are still in the building. You cannot take the animal away from them. You are not the police. You cannot seize the animal. So definitely be very careful if you're doing this step. I've never done it for a suspect cruelty case, but I have had to for drug use issues and some other issues, and it really escalates the situation. So you try to avoid that if you can, and then definitely make sure you continue to include the vet team with what's happening and what outcomes are going on. So now that you know that this can be a problem, it's important for you to prepare as best you can for the future before you have a case in front of you. So there's a lot of things that you can do. So one, look up your state requirements and laws. AVMA does have it on our website. There's a really nice PDF handout and let you know, okay, what resources should you have available for clients? You can have pamphlets out. You can talk with your local shelters, find which ones will allow animals to come, talk with your domestic violence shelters, find out resources to refer for social work or other help that clients may need, and have a booklet in your clinic to be able to help them. And make connections now with people so you know who to call if there's a problem. So I would try to know a police officer you feel comfortable with, or lawyers in the area, social workers in the area if you can. And then, like I said, we have an animal welfare department in Maine, which is nice, and so I connect directly with that veterinarian for these cases. Much better to talk to someone directly as another professional than just making an anonymous call or a report to someone you don't know. You want to be able to talk more about these situations. And then also there's trainings out there. So I train everyone on what to do and try to have a single team lead. These can become really serious legal cases, and there can be a lot of cyberbullying depending on how things work out. So I strongly recommend making sure the veterinarian is who is doing the reporting, who is covered by liability, or talk with your hospital owner or practice manager to come up with a plan that everyone's comfortable with to make sure that everyone in the hospital is protected too, depending on what happens next. Like I said, AVMA has resources. Our website is there. And other action steps, so like I said, look up your state laws, see if you're a mandatory reporter or not. In Maine, veterinarians are mandatory reporters for animal cruelty, suspect animal cruelty. We can report for suspect neglect, and we are protected from liability if we make those reports. As long as they're safe, look up the report country you would talk to if there's a problem, and work with everyone on the team. Try to develop a hospital policy that you would follow for suspect cases, and make sure the whole team is on the same page and knows what to do. Thank you.
I'm Dr. Bethany Coe. I'm with the University of Tennessee Center for Veterinary Social Work. And I'm here to talk today a little bit about the social worker perspective when it comes to the link between human and animal violence. So, what is social work? So, social work is a title protected profession, meaning that someone calling themselves a social worker should have a degree from an accredited university or college in social work. And the profession is dedicated to enhancing well being and promoting social justice. Social workers do this by working with individuals, families, groups, communities to address challenges and help people develop skills to better cope with what's happening around them. Many social workers focus on areas of interpersonal violence, whether that's intimate partner violence, child abuse, or elder abuse. And that goes with what we're talking about today. You may notice here in the preamble, this is from the National Association of Social Workers Code of Ethics, which provides guidelines for what social workers do in their professional ethical standards. That I've highlighted a couple of things here. So that the social work profession is the primary mission of it is to enhance human well-being and help meet the basic human needs of all people, with particular attention to the needs and empowerment of people who are vulnerable, oppressed, and living in poverty. So, how does that work when we're talking about domestic violence, where situations where an animal is present or an animal is also being used? Well, there is a specialty area of social work practice called veterinary social work. Veterinary social work addresses the human needs that arise related to human-animal relationships. Another way of thinking about it is that veterinary social work is in that space between social work practice, which focuses on the human, and veterinary medicine, which is focusing on the animal welfare needs. So it's inherently interdisciplinary because social work is a human-focused profession, but we're looking at the whole system. And if we're looking at a system that involves human and animal relationships, that means we need experts in the non-human animals. So our veterinary teams, our animal shelter workers, our animal control officers. We address the needs of all beings in the system. And that includes 4 different areas of practice. So this is the model that was developed at the University of Tennessee, defining what veterinary social work is. And in our model, there are 4 areas of practice. So one is animal-related interactions and experiences. This covers things like animal-assisted therapy, assistance animals, and overall experiences and history with animals. Animal-related grief and bereavement, or what most people might think of as pet loss. Intentional well-being, which is related to the ideas of all beings in the system, whether it's our vet team, our clients, the animals, there's well-being purposely pursued for all creatures in the system. And last, harm to humans and animals, which is where the link between human and animal violence falls. You'll also see on this infographic that we have here that we have macro and micro, meaning that there are interventions that are applied on both the micro level, which means working with individuals, and the macro, which refers to bigger systems, so communities, states, countries, and even globally. So you'll find veterinary social workers working in veterinary settings and clinics and hospitals, but you'll also find them in more traditional social work settings. So looking at your mental health hospitals, your assisted livings, your domestic violence shelters. They're working with people on their human needs, but also taking into consideration that human-animal relationship. So earlier in this presentation, you learned a lot about the link between human and animal violence. So there are different types of violence, and they don't occur in a vacuum. If you are going to see domestic violence or intimate partner violence, you're more likely to see other types of violence happening to other people in the family, such as child abuse, such as elder abuse, and also animal abuse. And also related to all of these, it's important to keep in mind, as also previously mentioned, that there are laws as well as your organizational policies that impact all 4 of these types of violence. So these are things you need to think about. So knowing the local laws thereby, And also, do you know in your agency are you supposed to do if you suspect animal abuse, if you suspect domestic violence, if you suspect child abuse? Do you know what your organization says is the proper process and procedure? So, why is it important to ask about the animals? So, for our veterinary professionals in the room, this may seem a bit obvious. So, you spend your life asking people about their animals. And sometimes people tell you a bit more than you actually wanted to know. However, for many human welfare professionals, like social workers, they haven't always necessarily thought about asking about animals in the client's lives, and they're missing out on a potential wealth of information. So, if we don't ask about the animals, we don't know what role this animal plays in this person's life. So, you might assume if the animal is important, that the client will bring them up. And that's not always the case. Sometimes clients have been criticized for being too focused on their animal or um, just not talking to people that are, quote, animal people. And so they won't bring it up. When in reality, that animal may be the most important relationship in that person's life. So that's influencing their decisions about whether to accept services, whether to leave a violent situation. So it's important that we ask. Also, it can be a great icebreaker. I mean, how many times have you talked to someone and it's a very awkward conversation, but you ask about the pets, and then suddenly the person is talking a mile a minute and getting out their phone to show you all their pictures. Right? So suddenly they're a lot more comfortable talking to you. And that is really important when we're talking about serious things like domestic violence. Knowing about how important this animal is lets you know how important this is going to be in the planning for this person's next steps. So everyone has a different relationship, and that relationship influences what decision they're going to make. And if we don't ask about it and we don't know, we're potentially missing a big barrier that that person has to seeking services. And also, people, particularly children, are more likely to tell you what's happening to their animals or what has happened to their animals than they will what's happened to them. So we can gather a lot of information that we probably wouldn't have known otherwise by asking about, do you have any pets? Oh, what happened to that pet? Right? Getting more information. And this graphic comes from the National Link Coalition. Animal abuse is also known sometimes in the research as a red flag for the other types of violence. And so it's that little tip of the iceberg. If we can notice what's happening with the animal, we get a better idea about what's happening in the rest of the household. So how do we get help? You heard earlier in this presentation a lot of great tips and resources for safety planning with survivors. So the help that's available really varies by where you are. So every state in the United States, as well as the territories, have a state coalition dedicated to domestic violence. You can find information about that on the National Network to End Domestic Violence website. So they can connect you to your local resources, as well as information about state laws and policies and procedures. Depending on where you are locally, you may have domestic violence shelters or crisis centers in your area. Local can be very helpful, but you can always start where you've had the information. So obviously, if you're in immediate danger or your client is, 911 or whatever your emergency services number is, please call that. And if you really don't have any idea where to start, there is a National Domestic Violence Hotline, the hotline.org. It's 1-800-799-SAFE or 7233. You can also text START to 88788. They have resources They can talk to your client about their next steps, what's happening in their life, help them think through the different possibilities, whether they want to stay, whether they want to leave, what options they have. And also connect them to their local shelter. Again, we talked a little bit about safety planning earlier in this presentation, but just some things to think about if you do have a client that has an animal and they want to leave with that animal. This is an ideal situation. If ideally we have time and resources, we can work with a domestic violence advocate. They have the skills, they do this on a daily basis, working with clients to best safety plan and plan their escape. However, every situation is different, and safety should always be the priority. In the event it's determined that the client is best served, is going to stay safest by leaving immediately with their animal and the clothes that are on their back, that's fine. Don't let not having this go bag stop someone from seeking safety. Okay, so we can deal with the things that they can't have all the belongings later, but we always want to prioritize safety first. But in an ideal world, if we can work with an advocate and we can have a plan, in addition to the go bag that the advocate's going to talk to your client about, involving money and ID and clothes, medications and records and all those good things, we also need to think about the vet. So the pet's go bag, you need to have a way of restraining the animal. So ideally, they're harnessed and leash, they're a carrier, etc. This animal is going to be brought into a place with lots of other people. It's a strange place. We want to be sure the animal is safe as well as any other people that are around. Proof of ownership. So in the United States, animals are considered property. So having proof of ownership can be important. This can be a bill of sale, documents showing that this client has been the one taking care of the animal. Any medications, any vet records can be very helpful to have. A lot of shelters are going to want vaccinations or proof of vaccination. So having that available is useful. A favorite toy or blanket. So this is going to be a strange situation for the animal as well as the human. So having a familiar thing that smells familiar and safe can help calm the animal down. And if you can, the food that they typically eat. So lots of change as humans, it happens to us too. Our tummies get upset. So if we can have similar food to what we're used to having, that can help with that. Sometimes people wonder, what does getting help look like? What is available? So one of the main priorities most people think about when it comes to domestic violence situations is housing. So the emergency housing, if someone's left a situation, they need somewhere to stay. So that could be your domestic violence shelter. And also thinking long term, particularly if we're leaving with an animal, we need to think through pet-friendly housing. Where are we going to go after the shelter? And the domestic violence services can work with that. A connection to legal services. So your domestic violence shelters, the resource centers, they're going to help connect the client with legal resources. So whether that's to get an order of protection, to get a divorce, to deal with child custody issues, whatever legal issues are coming up. Employment. So our domestic violence shelters are going to help clients engage employment if they don't have it. A lot of clients end up very isolated in their domestic violence situation. They may not have been allowed to work, or they need to get a new job that their abuser doesn't know about. So working to find employment. Health services, of course, is very important physically for any injuries that may have occurred, as well as mental health support, as well as child-related services. So getting children enrolled in local schools, getting child care, getting child mental health or physical health taken care of as well. So these are all options that your local domestic violence shelters can help clients work through. to keep in mind is the concept of cross-reporting. So this idea is just that communication between multidisciplinary agencies and organizations to report abuse and neglect. So put it very simply, that our animal care professionals and our human care professionals need to be talking to each other so we can get this wraparound services and support to the people and animals that need it. So if you're a veterinary professional or animal welfare professional, do you know who to call if you suspect domestic violence? Do you know who to call if you suspect child abuse or elder abuse? And human professionals, do you know who to call if you suspect animal abuse? It's also very important to know your laws, as they do vary greatly depending where you are. And cross-reporting may or may not be legislated where you are. If it is, it can vary about which professionals are protected and may actually be a combination of laws of mandatory reporting of child abuse and specific professions that are allowed to report animal abuse. But it's a good concept to keep in mind. Some other things to think about. What else can you do? So if you haven't already, connect with your local domestic violence resources. What relationships can you develop? Do they accept pets at your domestic violence shelter where you are? If they do, what resources do they need? Do they need veterinarians that will look over the animals that are coming in and provide vaccinations? If they don't, what other options could we have? Is there a boarding facility somewhere that could house pets of domestic violence survivors? Your local animal shelter, could they help? Developing those resources and connections makes a big difference wherever you are. Right? Consider having a community resource board in your clinic. So you never know what a person might be going through. You may see the signs, you may not. But having the resource board lets people at least have the option to look for resources that they might need, and also offers you as a safe space to talk about those resources that are on your board. And to learn more, consider checking out the National Link Coalition. It's the website nationallinkcoalition.org. They've been doing this kind of work for decades and have a lot of helpful resources about state laws, how to report, and different research that is available. Thank you so much for your attention. And if you have any questions, please feel free to reach out.
Hello, this is Dr. Kendall Houlihan. I'm an associate director in the Animal Welfare Division of the American Veterinary Medical Association. Mary Carmen, Dr. Biesel, and Dr. Poe, thank you for sharing your expertise and valuable information with us. Also, many thanks to my co-host, Megan Senatori, and the American Bar Association for collaborating with the AVMA. And to all of you who made time in your busy schedules to watch this on-demand webinar. This pre-recorded session will be followed by a live Q&A on October 22nd, 2025 at 12 p.m. Central to facilitate a further conversation about how interprofessional collaboration can improve outcomes for people and animals affected by domestic violence. While attendees will have the opportunity to ask the panelists questions on October 22nd, we invite viewers to submit questions to axon@avma.org now, as the Q&A will be recorded for those who are unable to attend the live event. Again, I want to personally thank all of you for joining us and for all that you do for your critical professions and the human-animal bond.